Hey there, it's Dr. Wright. This week we are going to be talking about, I should say in this unit, we're going to be talking about birth and the newborn baby and also the period after birth, so postpartum, and how does that go for family and how does that go for baby and what are they doing and what are they learning and all that fun stuff. So I will tell you that um, as a person growing up, I always heard from people that like giving birth was like the most painful, horrific thing. Um, and so as I got older and thought to myself, like, I don't want to do that. I don't want to have kids. Um, I will tell you that there are options. So, if thinking about the idea of having children because it's painful, makes you scared to have children, then I would say, that's really not the part that we want to worry about so much. There are options, there are pain options, all that sort of stuff. Um, the process of pregnancy, as I've talked about before, can be emotionally overwhelming. It's physically draining, but now we are at the end. We may be experiencing what's called Braxton Hicks contractions, which are what some people call fake labor. And it's basically a tightening feeling in the abdomen. Um, and usually, if you walk or if you use the restroom or if you move somewhat, they will stop. Whereas actual contractions that are going to produce labor and are going to produce delivery and birth, a lot of times they are, well, they're first of all a lot more painful than your Braxton Hicks contractions. And usually what will happen is they will start like at the top of the abdomen and kind of roll down. It's almost like you can feel them rolling down your side, which is a really weird sensation. Um, but basically, what's going on inside your body is that your body is, pushing baby down towards where it will be born, towards the birth canal, right? So the muscles are kind of tightening and then loosening to move this baby down into the position that it will be born from. Regular contractions, actual contractions that will produce labor, are going to be more painful. And walking or moving, using the restroom will not get them to decrease. Usually they will last for, at the beginning, they'll last for, a minute or 2 minutes. And then they'll stop and then they'll come back. And if you're close to your due date, you really want to start timing them, see how long they take, and then also see how long you have in between them, because they should get longer, and then the periods between them should get shorter, right? That would make sense. Um, and this is when you need to contact your doctor, or maybe if they're lengthy and close together, then you need to get to the hospital if that's where you're having your baby. So, another thing that this chapter talks about is the idea of that we can, we can give birth in different places. This is something that you will want to talk to your doctor about, because if you have some medical challenges, there won't be as many options for you. So if you need to be monitored because of health conditions, then most likely birthing in a hospital is going to be your only option. Whereas if you are generally healthy and you've had a healthy pregnancy, then you may be able to do a home birth. You may be able to do, for example, a water birth at a birthing center, things like that. These are things that you're going to want to talk to your doctor about. Um, Sometimes during our pregnancies, we might attend a birthing or parenting type class. And one of the things that they talk about during these classes is to create something called a birth plan. And this is basically like your idea of how you want the whole birth process to go. Some people have, think about like, how some friends have this idea in their head of like what they want their wedding to be like, and they want it to look like this, and they want so and so there, and all this sort of stuff. Some people have that for the birth of their child as well. So, I've talked to people that will say things like, oh, I want it to be a relaxed atmosphere for my baby to enter the world. And I want there to be candles, and I want, to do a water birth and all this sort of stuff. And so some people, like I said, really have this idea in their head of like how this is going to go. And I will tell you that most of the time, your birth plan is probably not going to be how the actual birth process will go. Some of us may experience medical complications that mean that we have to have a cesarean section, so they actually have to do surgery to remove the child. Sometimes you are in labor for an extensive period of time so that candles and water birth and all that sort of stuff aren't really an option anymore. I've talked to some people that say, part of their birth plan is to do a completely natural, no medication childbirth. And then there's other people that say, you know what, like, I don't want to experience a lot of pain during the birth process. So when they ask if I want an epidural, then I'm going to say, yeah, get the anesthesiologist in here and let's get this epidural done. So an epidural is basically a pain shot that we get in our spinal area. And a lot of people say like, oh, but I'm worried about the pain of the epidural. And I'm like, let me tell you something. The pain of the epidural, hold on, dog barking. The pain of the epidural is nothing compared to the pain of unmedicated childbirth. So if you're worried about a needle in your back, you might want to be more worried about the pain that you'll experience if you don't have an epidural. There are some people that say that epidurals can cause problems, and there is a slight risk of problems with epidurals. And so you will want to talk to your OB and the anesthesiologist about those, just so you can make sure that you know what the potential complications are, and how to recognize them. So for women who are having a vaginal birth, you will there's a couple of things that we want to keep in mind. Usually the birth canal is not sufficiently large enough for baby's head to come out, baby shoulders to come out. And so either we will experience tearing in that area. So it's basically a tearing in between the anus and that opening. Or if the doctor knows that tearing may occur, they may do something called an episiotomy, where they may make an incision to basically cause that tear. There's research on both sides that says that letting people tear is by themselves is better, whereas there's research that shows that cutting and making a clean break as opposed to a tear is better. So you'll want to discuss that with your OBGYN as well. As that heals, it will be uncomfortable. It will be itchy. I mean, it's a scar, right? Well, it's a cut. So a lot of times people think, once my pregnancy is over, I'll feel a lot more comfortable. I'm like, well, afterwards, there's a lot of other stuff that some people may not tell us about that is going to happen that still isn't comfortable. So for example, if you have to have a C-section, then, I mean, it's a surgery. So you will have stitches, and you will have to, be on bed rest until your sutures heal, that sort of stuff. And then once our pregnancy is over with, then the blood that was helping baby to continue to live will be expelled from the body. And so most women will bleed. It's really like a really, really heavy menstrual period for between 3 and 10 days after the end of their pregnancy. So the hospital will usually give you these really, really thick pads. And then you should probably have some waiting at home as well, because they don't give you enough for, however long it's going to last. There's also, especially if you have anesthesia, the likelihood that you will experience constipation. And also because of the fact that you have a tear towards your anus, we can get really worried that defecating might cause it to reopen. And so there's some anxiety there about that. But also, there are challenges with defecating as well. So we might be taking, or we probably should be taking, stool softeners to help with that process. And I know everybody's thinking like, oh, this does not sound like fun. No, it's really not. But at the same time, that's, if the outcome that you want is to have a baby, then this is what you're going to experience. First couple of days home with baby. Baby is going to continue to sleep a lot. They go through periods of like waking and sleeping, but most of the time is sleeping. We used to joke, my husband and I used to joke with my first son that his eyelids were broken, because he literally just slept all the time. And I kind of feel like this is kind of preparing us for when the baby is more awake throughout the day. So it gives us time to like rest a little bit and recuperate. And then, you've got an infant that is awake more often, wants to feed more often, all that sort of stuff. What other things does this chapter talk about? So it talks about the stages of childbirth, anesthesia, having conversations with your doctor about that sort of stuff, birth strategies. We can talk about, if baby is born early. So usually we talk about 37 weeks or earlier is considered preterm. We can also talk about small for date infants. So these little guys or girls are unusually small for their age. And sometimes when we have baby, we realize that it's a lot larger. The baby's a lot larger than we expected it to be. And sometimes that's because we got dates wrong. They do a lot of prediction of when the baby will come based upon when our last menstrual period is. And we may or may not remember, have written it down, things like that. Not everybody does. So we might or might not be off in terms of our dates. And for my experience, I had my oldest son at 38 weeks. And then my younger son was born at 34 weeks. So he was preterm. He was a preemie. And one of the things that is kind of a big discussion point within obstetrics and moms groups and other mom bashing is the idea of choosing your due date and having an elective induction. So we can induce pregnancy after a certain period of time. Your doctor may be open to inducing pregnancy, or I'm sorry, inducing birth, not inducing pregnancy, inducing birth. And usually that they'll schedule that for at least after 37 weeks, if not later. And there's multiple reasons why we might want to do that. We might want to do that because we are having family and friends that are flying from other places come in for the birth. We might want to do it because we only have a certain amount of maternity leave. And so we want to be able to schedule that. There's lots of different possible reasons why you might want to have an elective induction. And so if you think that you might want to have an elective induction, an elective means that you choose to it, right? then talk to your OB and see how they feel about doing elective inductions. Some people don't do elective inductions, and some people are perfectly happy to do it. One of the reasons why doctors like to do it is because then they can help you choose a day or a date that they will actually be available to see you, because otherwise, if you go into labor on a day where they're not working, then you might not be able to have your actual doctor there to help you with the birth. You might end up with a different doctor. So some people say that, baby should come when baby is ready to come. Other people believe that, doing an elective induction is perfectly fine. So again, you make your decision and ask your OB what they, how they feel about it. And if the OB that you thought you were working with says, no, I don't do that, then you can look around and find another one. We also do see that sometimes people are on certain medications that make it important for them to induce at a certain time. So for example, I was on medication for blood. I was on blood thinners because I've had a stroke before, and also because I have a clotting disorder. Um, and so for my first son, we had a planned induction at 38 weeks so that I could manage my medication, because I couldn't take my medication up to 24 hours before he was born. 12 or 24, I can't remember which one, but anyway, that was 13 years ago. So we had to plan it, because then I could stop taking my meds, right? With my second son, at 34 weeks, my body just decided, I joke that he decided, but my body just decided that it was done and it was kicking him out. And so I had to wait around for a little while I was actually in labor, before they could give me any medication, because of the fact that I had taken my my blood thinners. So it's almost like we had to try to delay it, because of the fact that he was so early and I had taken my medication. So you might, because of medication stuff, you might be told, we're going to do an induction. We're going to plan the induction for this date, things like that. Some people joke it's an eviction date too. So a lot of times when children are born prematurely, they will spend as much time as they should have spent in the womb, in the NICU. So since my son was born at 34 weeks, then maybe, we could have predicted that he would have been in the NICU, the neonatal intensive care unit, which is where they have all the babies in, I joke, the babies in boxes, but in incubators with, heat and oxygen and all the stuff that they need, or isolates is what they call them as well. But they'll usually be there until they should have been 38 weeks. But that's the average. My son was born at 34 weeks and 4 days, and he was born on a Saturday morning at like 12:30 a.m. And he went home on, I want to say it was Tuesday, like the Tuesday after that. He, as a baby, just, they'd put in a line for saline, and they'd put in, the nasal cannula and all this sort of stuff that would, help him. And he removed it, like literally just grabbed and pulled the stuff out. So they ended up taping almost everything to the back of his skull so that he couldn't reach it. And he ended up with these like tape marks on his face so that he couldn't pull the nasal cannula out. Like, this poor child. But at the same time, in terms of like personality of how he is now, I'm like, yeah, that totally makes sense. Like, I could see Sage being like that and being like, nope, I want out of here. Take these things out of me. He was not, he does things his own way. Let's just put it that way. So what else do we want to look at? So after baby comes home, what's going on? So a couple things that our book doesn't talk about that I think are important and interesting is the idea of identity transition. Instead of being a pregnant person, you are now a mom. Instead of being, waiting for a baby to show up, you might now be a dad, or it might be the other mom, right? And it's it takes the brain some time to move from like I'm an individual to I'm someone's mom, that I have to care for this tiny person, and it's my job and it's my life. And um sometimes it can get really overwhelming. And I try to remind people that the only thing that is constant with these little ones is change. So while they may be crying nonstop for the first couple of days, eventually that will change. And, if there's stuff that's going on that's frustrating you, that's overwhelming you, eventually that will change. When we start talking about, later development, we start talking about sleeping and sleeping through the night stuff. Um, I've talked to some people that are like, oh, my baby slept through the night at 10 weeks. And then everybody else who's had children, like, gives them like nasty stares because some people's kids don't sleep through the night. And so they wake up in the middle of the night multiple times until they're, 5 months, 8 months, that sort of stuff. Um, so you just have to keep in mind that this is temporary. This will end, but something else will show up and it might be worse. And sometimes it is. So one thing that a lot of people ask is like, how do I help a baby who's crying? So the book talks about babies cry because they're in pain. I think of it as babies cry because they're uncomfortable. Pain obviously is one reason why they're uncomfortable, right? But wet diaper, poopy diaper, hungry, tired, um, gassy tummy. A lot of babies have gassy tummy when they are newborns. And if you've ever like had to fart, but it just wouldn't come out, like there's been times that you've probably thought to yourself, like, I would really feel like crying right now. And so that's what baby does. It's like, hey, there's something off with me and it hurts. And so I'm going to try to tell somebody my only strategy to do that is to cry. So we want to, think about those things, kind of make a list. Check the diaper. Diaper good? Okay. Has it been fed recently? If not, is it hungry? Let's feed it. And I say it because it's just, I'm instead of saying, the boy or the girl or anything like that, like we're just talking about the baby. So feed it. Is it cold? Make sure it's warm enough. Is it tired? You will recognize that baby will eventually get on a sleep wake cycle. And so you'll know like, oh, hey, look, it's 2 o'clock. Like it's sleepy time. Um, is it, does it have gassy tummy? So if you kind of press on the belly, not hard, obviously, does it feel like dense or hard? And if so, and also if they start crying more, they make some drops called Gas X. You can try those. Wait, those are adult. Gas is adult. Brain is not remembering the name of gas drops for babies, but you can find them. Just ask the pharmacist; they'll point you in the right direction. And they work typically very well. You can try those. You can also do some exercises, some abdomen exercises. So kind of like lifting them up by their feet and doing like bicycle exercises can help to release the gas. But there's, lots of strategies that we can use to do that. And, Google is your friend in terms of learning strategies to expel gas from baby's tummy. Some people do experience postpartum negative feelings. So we can talk about the baby blues. Some people think about it as like, there's this exciting thing coming up and now it's over with. And so it's going to last, baby blues might last like a couple days, couple weeks. But it doesn't really involve actual symptoms or symptoms of clinical levels of depression. whereas postpartum depression will actually demonstrate clinical levels of depression. So, without having had a baby, if we exhibited these symptoms, then we would be demonstrating clinical levels of depression that would be treatable. And so we want to keep an eye on our friends. We want to keep an eye on our partner. We want to keep an eye on our, coworkers and our daughters and things like that, and see how they're doing. And not just, because a lot of times we'll just say like, oh, I'm tired, but I'm good, and it's like, but are you really? Um, and so, yeah, we want to check in with them. And we will do uh, some activities within the next couple of weeks about, helping couples, especially how to help couples to communicate better. Because I will tell you right now, once we get into the nobody's been sleeping well phase of post pregnancy, there's a lot of like griping, complaining, bitching, fighting, if you have a partner, because we're both tired, we're both frustrated. There might be some overwhelming noise going on that we can't seem to get to stop. And so, yeah, we may just, be angry and bitching at each other for a period of time until everybody's sleeping better. We have to make sure that we're eating. A lot of times people forget to eat. But especially if you're breastfeeding, you want to make sure that you're eating, because otherwise calorie content, right? Um, but so, yeah, we definitely want to be checking in on our relationship, and making sure that we as a couple understand that we're going to be tired, we're going to be frustrated. And I remember working as a counselor, and I would tell people right before they had their baby, like, during the first 6 months after you have your baby, you cannot threaten to divorce your partner. Unless, we're talking about extenuating circumstances. Because we're all going to be tired. We're all going to be popping off at the mouth and saying stupid shit that we shouldn't have said. So we just want to, make that one rule of like, it will not come to this. Now, after we're sleeping better and, we've got good frontal lobe functioning going on because we're not as tired and we're not as hungry and all that sort of stuff, and we've recognized that like this really isn't just working out, then we can have that discussion. But don't do it while you're tired and overwhelmed and frustrated with baby, because it will just escalate things. So, yeah. Welcome home, baby.